Hello everyone, welcome to ITV Go Live. I'm your host Aditi Lamba. Welcome to our show this afternoon. The state of Florida is showing record surge in its case numbers with at least 233,000 cases with at least 4,000 deaths. Joining us today, bringing in much perspective on what's happening in the state of Florida, especially in one of the hardest hit cities of Miami. We're being joined by a mayor of the city of Miami, Mayor Francis Suarez. Thank you so much for being with us here on ITV Gold. Welcome to the show.
Thank you for having me. I appreciate it.
Of course, it's an honor to have you here, and it's so important for us to discuss what is happening in what is being called the new epicenter of this coronavirus pandemic. Just starting off the show, I have to ask you one of the biggest questions of the hour that the entire nation is asking. Did the state of Florida reopen too fast? I know the city of Miami was one of the last ones to open, but according to you, after looking at all of these surges in cases, do you think the state opened too fast?
You know, I have been getting that question a lot. It's probably the question I get the most often. And the truth of the matter is there was a criteria for opening, right? And the criteria required us to have a declining number of cases for 14 consecutive days, at least in Miami. And we had a declining number of cases for 30 days. And so the question becomes, you know, and I think this is part of what's happening now. What is the long-term strategy, which is, you know, we have to know as a community, what is the objective? And I think what happened is when we did the stay-at-home order, we got the virus down to a very, very low level. And unfortunately, when we opened, you know, people started behaving as if the virus didn't exist. They forgot about how efficient the virus was at spreading. And so we got to points where we had almost 600% faster spread in the last few weeks than we had back in late March, early April when we put in a stay-at-home order. So I think it was unfortunately more behavioral than it was operational in terms of when we opened up. And I think that's the challenge that we have now, which is to you know, continue to message that this is a virus that spreads very rapidly and can be very deadly.
Definitely. What is the current rate of hospitalization and how rapidly is it increasing in the city of Miami?
It's at the highest rate that it's been since this began. We have over 1,700 people hospitalized from COVID. Our ICU capacity is at about 11%. And we have ventilators, you know, people on ventilators are almost at the highest level. So what we haven't seen yet, and hopefully won't see, but are likely to potentially see, is the death rate going up. The death rate has remained low, which is a good thing. And treatment has gotten better in the months that we have been dealing with COVID. But the hospital capacity issue is definitely a worry. And the fact that, you know, the death rate has remained low is obviously a good thing. But we're seeing disturbing numbers from ventilators that might increase the death rate in the future.
You know, we saw the same situation here in the city of New York, in the entire state of New York, where hospitals ran to its capacity. There weren't enough ventilators. There weren't enough hospital beds. If that situation happens in the city of Miami, are you ready to call in national troops or get more help from the federal and state government if needed?
Absolutely. I mean, we had, and we still have some excess capacity, sort of what you call portable hospitals. We've created one in the Miami Beach Convention Center. We had one in Tropical Park, which we actually closed down. So we would probably reopen that if we needed to. But certainly hospital capacity, and it's not just hospital capacity, it's the personnel. Because you know, what people don't understand is a ventilator, it's not just a bed. It's a machine, plus it's the people who know how to operate the machine. It's a team of people that create a ventilator bed. And that's not something that you can just replicate overnight. So there is definitely a possibility that we may need at some point to ask for some help from some of those other governments.
Are there enough frontline workers in the city of Miami currently, and is there enough PPE supply for them?
Right now, we're okay on PPE supply. I haven't heard anything negative about PPE supply, and it appears to be that we do have enough frontline workers, but it all depends. I mean, that's a question that is, you know, it's a static question, but it depends on a moment in time. So today, we have that. If you know, the curve doesn't flatten, and we're starting to see, by the way, some evidence that it is flattening in Miami-Dade County. If it doesn't flatten, then we could have an issue going forward.
Oh, wow. Are you looking for more help from the local governments or the federal governments in order to get some more PPE supplies? Or are you also looking for donations of PPE supplies? We saw that again happen here when New York was the epicenter.
We are getting a tremendous amount of donations for PPE supplies, and we always welcome them, certainly masks in particular, because we have implemented a mask in public rule.
Yes.
So masks is one that we would definitely welcome and you can just find me online. I'm very easy to get a hold of. Send me an email if you want to make a donation. And I think we have asked the state of Florida for 500 new contact tracers, which is what we feel are going to be needed to actually contact trace the volume of people that are getting sick at this particular moment. The governor has given me a good indication that we might get that, and so we're going to be following up on that.
In terms of masks, let's discuss that. You were one of the first mayors to come out and implement a mask mandate rule with penalties if people don't follow that. How important was that rule for you to mandate in the city of Miami at that point? And we haven't seen this happen in the state of Florida. What would you say to the governor right now in terms of mandating this rule?
First of all, we're starting to see some early signs that the mask in public rule is working. Like I said, the rate of spread has diminished in the last 2 weeks by about half, and that's significant. That doesn't mean we're not getting more cases. That just means that the rate of spread is diminishing, and we trace that back to when we implemented the mask in public rule. So I think messaging on this is extremely important. I've indicated to the governor what my preferences are. Obviously, he's got to make his own decision, but I think to me it's a no-brainer because it's something that everybody's recommending, no matter what, even all the way from the CDC all the way down. All the medical experts are recommending it. So to me, it's not a big stretch to make it mandatory.
Yeah, and it's so important to reflect that a lot of medical professionals and doctors are all calling in for universal masking. Do you think federally we need a verdict on it perhaps, or a statement on it, on the mask mandate?
I do. And one of the things that I've learned is that messaging is important. I was talking to a doctor from Johns Hopkins last night who was telling me that right now communications is our best vaccine. We don't, in the absence of a vaccine, communication is our best vaccine. And so I think messaging, when we're all unified in what the message should be and what actions we should take, everybody does it, and that's what gets things under control.
And looking more at coronavirus and its impact right now, Mayor, what do you have to say about testing in the city of Miami or perhaps the state of Florida? Is there enough testing available? And in terms of testing, which is being looked at as more focused? Are you looking at just COVID-19 testing, or are you also looking at antibody testing to determine who's already immune?
There's both kinds of testing are pretty ubiquitous. You have people who are able to get tested for no reason. In other words, they can be completely asymptomatic or have no symptoms and get tested. And we do know a big percentage of the people that are getting tested because their office and their work is asking them to get tested. Having said that, I think we can do better in terms of how quickly people get tested and how quickly people get the results. That is a critical component in what they call the R naught, which is how many additional people get sick once somebody got sick. And we need to reduce that number, that statistic significantly.
Definitely. I have to ask you, at this rate, when the state of Florida has become the epicenter, city of Miami is one of the densest cities in the state of Florida. There are a lot of cases happening. Do you see yourself implementing a stay-at-home order or something similar? Do you believe residents need to stay inside right now?
Listen, I think a stay-at-home order is an order of last resort. I've never said at any point that it's outside of out of the question. So it's something that we certainly have in the toolbox, and it has worked in the past. The concern that I have right now is obviously our economy is not where it was a few months ago, and I don't know what the federal government's ability to sustain us through a stay-at-home order is right now. So I think those are factors that we have to weigh. I think there has to be very compelling evidence that we have no other alternative, whether it's shutting down an industry or shutting down another targeted. And we're not there yet with the contact tracers for us to be able to make a decision of that magnitude.
Looking at coronavirus and its impact, I have to ask you a question that's been asked by many around the country, which is the disproportionate impact on Black and brown communities. There are a lot of those communities residing in the city of Miami. There's a lot of South Asian American community there as well. What have you seen as the impact of COVID-19 on these communities, and what are the resources available for communities that are being, that are at the most vulnerable spot of this disease?
Well, there's no difference in Miami from any other part of the country. We certainly, and we're sort of a minority-majority community, so we're a little different in that sense. We have a lot of Hispanics, a lot of African Americans, and so what we're trying to do is number one, we're giving out masks very liberally because we know people either A, don't have the resources or B, don't know where to get them. So we're giving them out, particularly in the zip codes that are the most predominant. We also had a rental assistance program we implemented citywide to help people be able to pay their rent. We have, like you said, in-home testing in the city. We actually go to your house and we'll test you at home, so you don't even have to drive. If you don't have a vehicle, you don't have to put other people at risk. You don't have to stand in line. So we've done a variety of things, and we're also feeding a tremendous amount of people right now, which of course is the most basic need that we have other than breathing and water.
Yes, this also brings me to the economic and the healthcare ramifications of COVID-19 that we've seen across community. Of course, this one disease and this one virus had put such a halt on the economy, and right now we're trying to figure out what to do with it. What has been your personal experience with what has happened with the economy? And according to you, when economy and healthcare go hand in hand, how do we kind of balance it out? What is needed from the system right now?
Well, it's actually, to me, there's an inverse correlation right now, unfortunately, between the economy's health and the virus's ability to spread. And what we're seeing, for example, nationally, when our unemployment level dropped 7%, added 4.5 million jobs last month, that was the month where we had the most number of new cases. So to me, that there's an inverse correlation between our economy's health and people socializing and the spread of the virus. And so I think that's what makes this so tough, because what you do to one sector, you're doing to the other, right? So if you close down a businesses, you may have an opportunity to reduce the level of virus in your community, but you're also unemploying tens of thousands, if not hundreds of thousands of people. So I think that's why our decision making has to be very surgical. It has to be based on evidence, and it has to be as targeted as it possibly can be.
What kind of businesses should be allowed to be open right now? I know there's a conversation happening in the restaurant industry if indoor dining should be an option or if outdoor dining should be the main focus right now. How are you looking at these businesses that are kind of vulnerable because they congregate a lot of people?
Yeah, it's a tough situation, but I think where people are angry is the way the decision was made. That decision was made by the county mayor. And the first thing the county mayor did was he basically went back all the way to only take on a delivery, didn't meet with any of the mayors, didn't meet with anybody in the industry, and didn't really explain why the decision was being made. And then we know, because we get in the city from the Department of Health, that the contact tracing information we have does not right now show a definitive link between the increase in cases and restaurant patronage or restaurant employees. And so that was what created a little bit of a problem. The other problem is that there's inconsistency. For example, condo pools are still open, beaches are still open, commercial establishments are still open. So there's a lot of other places where people can congregate that are still open. And so then the restaurant tours feel like they're getting picked on because a lot of them, a big percentage of them, do not have outdoor seating. So it's a problem. It's a problem the way the decision was made, and I think it needs to be an evidence-based decision.
What do you think is going to be the future for the restaurant industry, or maybe perhaps in terms of these small businesses that are kind of in the heart of this crisis? What do you believe is going to happen to them in the next couple of months?
Well, a lot of them could go out of business. And I think what's unfortunate is there's also not a clear standard for how to get out of this, right? And that's where it's important. You have to articulate a strategy and get people to buy in. And I think what's happening now is you have people protesting, you have people saying they're going to defy the orders and continue to operate. And so because the process wasn't done right, you don't have a lot of compliance. And then that puts a lot of pressure on cities to try to create compliance in situations where, it overwhelms our resources.
What, according to you, has to be closed right now around the city of Miami or perhaps around the state of Florida? What is, according to you, the most essential things to close down?
Well, right now it's a hard question to answer because we don't have enough contact tracing data, and we should have it in the next, I'd say, 4 days, to have a statistically significant amount of data to make decisions. Part of what we've been pushing on the Department of Health is to get us the data. We make public policy decisions that have very, very dramatic implications and very, very dramatic consequences, and we can't do that in the absence of data. And so we're hoping to get that information in the next few days. To put it in perspective, we have about 70 surveys, then we had about 183 surveys. We need to get to about 1,000 surveys before we have a statistically significant sample where we can make some better decisions.
Another very big question that's coming from the state of Florida, and something that obviously impacts all of us right now in the nation: how are we protecting the elderly community? Florida has a lot of elderly population that resides there, not just South Asian Americans, but just everybody else. How are you protecting them? What are the resources available for them? And, should they just stay inside to be the safest?
Well, they absolutely should stay inside. They absolutely should isolate and stay at home if they can, without a doubt. There's no doubt about it. So because of that, we do in-home testing. Because of that, we have gone out of our way to give them masks in case they do go outside. We have messaged completely that they do need to stay inside. And then, of course, we're feeding them. And I think those are, like we're doing them for the lower economic rung, we're doing that also for the elderly. That is the safest way that we can protect them. And that's why so far, and I hope it stays this way, our mortality rate is very, very low. It's about 2%. I think New York got to about 8% at one point. So we're hoping that because we protect that vulnerable population, our mortality rate will stay low.
You just mentioned feeding the elderly, and this brings me to another issue which is so important and so pertinent during this entire crisis: food insecurity. We definitely saw it here when New York City was an epicenter, and we are seeing it now in the city of Miami as well as around the state of Florida. Your comments on how intense this problem is and all the resources that are available from your office. I know you're personally doing deliveries as well to ensure that Miami is being fed, but I would love for you to give some insight into that.
Well, it's an incredible problem. I mean, and it's something that I foresaw from the beginning, because as the economy breaks down, as people can't work, as people can't, those who are working on reduced salaries, they can't pay their rents, they can't pay their mortgages. At some point, you get to a point where they can't buy food. And that is a very, very, very worrisome point, because at that point, people's survival instincts have to kick in, and it could get, and I've said this before, it could get a little apocalyptic. And so my problem and my perspective is we've got to do what we've got to do to feed people and make sure that they have the basics. Otherwise, we could have a situation that's basically anarchy.
Yes, definitely. And how much is homelessness impacting the city of Miami? And is there work being done for that as well? Because obviously those have to be protected. Again, very underserved communities.
We're testing the homeless members in our community. We have portable hand washing stations for them. We're very blessed. We're a community that's very compassionate with the homeless. So we have, for a big city, we have about 900 to 1,100 homelessness at any given moment, which pales in comparison to other major cities. And the ones that are homeless are basically chronically homeless. They're the hardest ones. They basically want to be homeless. And that's something that's very difficult to change that behavior. But we're doing everything we can, offering them services, shelter, etc. And those that take it are great, and those that aren't, we're trying to get them tested and making sure that they're at least healthy.
What's your message to the community that truly needs help, that needs these resources? I would love for you to reach out to them through this platform if possible.
Listen, my message is simple, and it's a message that all medical professionals give. You have to wear your mask when you're in public. You have to be at least 6 feet away from people, and you have to wash your hands constantly. If you follow those 3 simple rules, there is a very, very, not a 100% chance that you are not going to get sick. If you are getting sick, it's because you are not following one of those 3 rules. And of course, we want you to obviously be safe and listen to what the public officials are saying.
Yes, definitely. Another popular question that's coming up, and I have to ask you, I believe you've also given some comments on this, the system of education. The Florida Secretary wants Florida schools to open starting next month in August. What is your opinion on this? And will the state be ready to have students in the school settings with coronavirus being to the intensity that it is right now?
It's really hard to say how we're going to be in August. It's hard for me to say how we're going to be next week. Yeah. I know that I just heard an interview with a superintendent from schools, and he's very concerned, and he does not want to jeopardize our students and put them in harm's way. So I understand the desire on the part of the Secretary of Education, and I respect him, and I think he's a great person, and I know him personally, and I'm a big fan of him. But, I think we have to prioritize the health of our children, and really not just our children, because if you have 300,000 kids, if there is a mass outbreak in that population, you're talking about the teachers. I mean, it can really spread through our community very quickly.
Mayor, what is required for you personally to open these schools? You have children yourself as well. What do you think is needed to make sure that our parents are calm when the kids do go back to school?
No, that's a great question. I do have two children. One of them does go to school. And I think, what we had been hearing up until recently is that he would be going to school. He's 6 years old. He's going to be a first grader. He'd be going to school with a mask on. And then also you have the option as a parent, they should have the option for them to continue virtual schooling, because some parents don't feel comfortable sending their kids to school and shouldn't be obligated to send their kids to school. And that's certainly an option depending on where things are between now and August.
Yes, for sure. Taking this interview right now, I want to sort of change the topic of discussion a little bit and get a little bit more insight into what's happening in terms of communication between the federal, local, and state governments. I would like to know how your communication has been with the governor of Florida as well as with the federal government. And, when you communicate with them, what have you told them as your priority that needs to be taken care of in the city of Miami?
Well, my communication with the governor is great. He answers my phone calls. He's very receptive. He listens. He has reasons why he makes decisions that he makes. But the resource that I've asked him for, and he was receptive to it, is the 500 new contact tracers. We need the contact tracers because we need to be able to isolate people who get sick, and we need to be able to know how they're getting sick and where they're getting sick so we can make good public policy decisions. The conversation I had with him a couple of days ago went very well. He seemed amenable to that, and his staff has followed up on that, so we're hoping to get that as quickly as possible.
President Trump is visiting Florida today as we are speaking right now. Is there any communication you're looking forward to having with him? And if so, what's the focus for that?
I think he's meeting with Southern Command, and I think he's meeting in Doral with a church. I'm here on the ground sort of working and making sure that my city's safe, and that's what I'm focusing on.
Yes, in terms of that, I would love for you to discuss what is your focus for the next 2 to 3 weeks. These are going to be very, very important in containing the virus or knowing what's going to happen to the curve of this, the flattening of the virus. What are you essentially focused on?
Well, I'm looking at the numbers, and I'm also focusing on trying to create a long-term strategy. Those are the two things that I'm focused on, and I'm looking at the numbers, and thankfully there is a little bit of ray of hope in the numbers that I'm seeing, and hopefully they'll continue. And because again, it's not good news, and we don't want to be in a situation where there's bad news coming out of Miami-Dade County.
Yes, for sure. We have a couple of minutes left here on the interview with you. I'd just like to ask you a very important question on the movement of Black Lives Matter. We've definitely seen demonstrations across the nation for over a month now. What is the city of Miami stand on Black Lives Matter movement, on racial justice, and as well as police reform? How have you sort of reflected on this entire situation?
Well, look, we're a city that is no stranger to police-involved incidents that have created civil disturbances in our city. It's happened in multiple occasions. As a commissioner, I had to fire a police chief because he implemented a policy, a practice and policy that led to a Justice Department investigation, which I just ended under my administration, the monitoring from the Justice Department. So, I think we've come a long way as a department. My current chief has fired more police officers than the last 3 chiefs combined. And we have a standard that we expect. Are we perfect? Absolutely not. Do we need to get better? We always need to get better. I don't think there's ever a time in life where you stop trying to get better. And I do think that this is a moment in time where you can use the momentum of this event to really look internally at your policies. Are we training our officers enough? Are we getting rid of officers who are racking up use of force complaints fast enough, right? To avoid situations like this from happening in the future.
Yes, definitely. Looking at this entire thing of racial justice and equality, I have to ask you, with elections coming up in November, how important do you think it is for all of us to exercise the right to vote? How important do you think voting is in order to make, significant changes in legislature or bills?
Winston Churchill once said, democracy is the worst form of government except for all the others. And I think what he meant by that is, it's an imperfect system, but it's the best system that we have. And we have to participate in that system in order to be able to complain about it later, right? And so if we don't vote, if we don't exercise that moment in time to make a change, then it is very, very difficult to be able to complain later about the decisions that our elected officials are making.
Yes, for sure. You know, Mayor, we are coming towards an end of this interview. I just have about 2 to 3 minutes left here. I'd like to take this moment for you to reach out to the families of Floridians and even, you know, Americans who have lost a loved one due to COVID-19. There have been over 4,000 deaths in the state of Florida itself. I would love for you to give a message out to these communities that are grieving and perhaps how they can reach out to resources for help.
Well, my heart goes out to them. You know, I was one of the first, I think I was the second person infected with COVID-19 in Miami-Dade County. So I'm very familiar with the anxiety of not knowing what's going to happen with your body. And I know in many cases, some of these family members did not even have an opportunity to say goodbye to their family members in person because they were separated and isolated from them. So it's been an incredibly tragic situation. And my hope is that all the efforts that we make will make the loss of their family members something that it does not happen in vain. And hopefully in the future, when we're confronted with a threat like this, we're better prepared to deal with it than we are today.
Well, I truly appreciate you for your time here, Mayor Suarez. I just would love for you to give one last message to a South Asian audience watching you live on ITV Gold.
It's an honor and a privilege to be on with you. This is an important segment of our community as well. And for me, one of the strengths of our city is our diversity. And so I'm very, very blessed to know that we have a robust collection of multicultural people in our community. And that's one of the reasons why I'm so proud to be their mayor.
Well, thank you again for your time, Mayor Francis Suarez. It was great having you here on ITV Gold.